Clear, bright, beautiful skin. It's something we are all born with. But along the way, things change. Unfortunately, for most of the population, youthful, soft, and supple skin gives way to acne. Red, bumpy pimples, whiteheads, and blackheads appearing mainly on the face, chest, and neck.
We each have thousands of pores on our face, some on our chests, some on our backs as well. Anything ever clogs this pore, whether it be makeup, dead skin cells, creams, lotions. What happens is the oil that's trying to get out starts building up and the pressure builds up. And you'll notice this canal is shaped something like a balloon before it's blown up, but what happens when the pressure increases, it blows up like a balloon.
Those red and angry-looking bumps usually pop up during the teen years, but acne can affect adults too.
About 15 to 20% of all of my acne patients are adults, and adults have the same follicle structures in their faces, so they can still get acne.
Acne not only causes scarring on the face, but having chronic acne can also cause emotional scarring.
It's hard for people without acne quite often to understand how this can affect people, but if you can imagine putting, say, 10 bright red acne stickers on your face, not just for one day, but for, say, 5 years, and trying to go out and talk to your friends this way, and then harder yet, try to talk to strangers this way and meet new friends with these on your face, or go to a job interview. I mean, these patients really have a hard time, and they suffer social withdrawal, social anxiety, depression, and even worse.
For years, it's been believed that acne is caused by defects deep within the skin's follicles. But new research by Dr. Chris Kreutzma is challenging that belief, saying blockage of the pores is the main culprit.
Up until now, acne textbooks and acne literature have not even mentioned the possibility that a blockage of the pore area could result in acne. And what I did to try to disprove this theory is I actually made a model of an acne follicle. And I showed that if you block the pore region, you indeed see the changes that we see in acne, which is an expansion of the deeper part of the follicle. And so, yes, a blockage of the pore area can result in the changes we see in acne.
From prescription medications to over-the-counter products, the treatment of acne is a multi-billion-dollar industry. Right now, acne sufferers engage in a number of rituals that may include many different pills and creams, all aimed at zapping zits.
When people come in to see me for the first time, they often have a big bag full of pills and creams that they've been using to treat their acne. And they often say, none of this has worked. And in addition to these not being effective, often they can have side effects and complications.
To help people banish bad acne, Dr. Kreutzma, or Dr. K as he is known by his patients, developed endofacne.com, a website with products and helpful information based on his current research.
I developed this website primarily to offer information about what's causing acne, and because with the knowledge of what's causing acne, people are more able to then prevent their acne, and they also have a better knowledge of how to treat their acne. I actually designed a two-step acne wash, and so I left creams and such out of this formula, nothing pore clogging. And the first wash is intended to remove the top layer, the dead skin cells, oil, makeup, and such. And then the second wash is intended to penetrate the pores and treat the acne.
Dr. Kreutzma says treatment is important, but people should also focus on prevention. In fact, Dr. Kreutzma says it's more important than any acne treatment.
The number one thing, according to my most recent research, is touching the face. You do not want to touch the face. That pushes the dead skin cells, oil, makeup, or whatever's on your skin into the pores and clogs them.
Don't touch your face and keep it clean. It's a common sense approach to clearer skin. For more information, log on to endofacne.com.